Hi, this is Dr. Peter Grinspoon. Thanks for joining my YouTube channel. Today we're going to talk about Cali Sober, otherwise known as California Sober, a controversial topic about whether people can use cannabis and psychedelics as a way to transition out of opiate and other addictions. Before we get started, please look on the bottom right-hand corner of your screen. You can subscribe for free to my YouTube channel. Please feel free to do so. Now, what is California Sober? First of all, I want to say that I don't love the title, but I love the concept. It's about addiction, and it's about finding different, new, and sort of non-traditional pathways out of addiction. Now, people are dying of addiction. 100,000 people died last year of opiate addiction. We need to help people who are addicted in as many ways as possible. And I'm very much in favor of having a big tent and meeting people where they are. What do I know about addiction? I'm in recovery for about 17 years from a vicious opiate addiction. I had the state police and the DEA raid my office, actually, in the year 2005 for some very bad prescriptions I was writing. That's what my book, my memoir, Free Refills, A Doctor Confronts His Addiction, is about. My miserable descent into addiction and how I clawed my way out of addiction and then actually started helping other physicians with their addictions. Now, traditionally, addiction treatment, unfortunately, has followed Alcoholics Anonymous and the 12-step programs. As you could tell from this video, I'm not a huge fan. No, I do want to say at the beginning that the 12 steps in Alcoholics Anonymous, or its sister, Narcotics Anonymous, which is like Alcoholics Anonymous, but as its name implies, is for narcotics, does help a significant subset of people. It helps them get and stay in recovery and lead happy and productive lives. So when I sound negative about the 12 steps in Alcoholics Anonymous, I don't want to knock or in any way belittle the fact that it does help a lot of people, but it's been studied. What is the success rate of Alcoholics Anonymous? 5 to 10% in some studies. Other studies show it's a little bit higher. So why is that the main treatment for opiate addiction or for alcohol addiction if it only has a 5 to 10% success rating? Alcoholics Anonymous was started in 1939. It's founded on the Big Book, and it's really focused on abstinence only. If you're addicted to anything, the only way to recover is to never use any drug or alcohol for the rest of your life. And that's a very high bar, a very high standard. And like, for example, when I was, trying to get my medical license back with the medical board, if I had any slips, they would start me at, 0.0, and I'd have to start taking drug tests again. And they wanted to have 6 to 12 months with absolutely clear drug tests. Now, on the one hand, you could argue that doctors, like pilots, really need to be like 100% abstinent. But on the other hand, they've studied recovery from addiction, and you don't magically go from addicted to recovered without any slips. It's just not part of the natural history. So we, as medicine evolved, we understand the brain, we understand addiction, we understand addiction as a brain disease, really, a big fault in your sort of dopamine system, and like it gets rearranged and you want the drugs and you want short-term relief from the miserable withdrawal symptoms. It really changes your brain. Other people think addiction is a learning disorder and that you just learn how to get your needs met in a very dysfunctional manner by taking the drug and by feeling better immediately, rather than through like more healthy ways of getting your needs met through like exercise and mindfulness and social connection. But as we understand more about addiction, we started to use medications to treat addiction. And again, this has been very controversial with the Alcoholics Anonymous and with the 12-step programs. For example, for opiate addiction, most of you have heard of methadone. Since the 1970s, we've been using methadone with incredible success. More recently, we use Suboxone. The chemical name is buprenorphine. And it's with incredible success that we get people, for example, off opiate addiction into stable recovery. They go on to live fulfilling lives. My patients on Suboxone, you couldn't even tell who they are, the ones in my primary care practice. They're like well-dressed, back to work, back to their families. They're living these normal lives. And we consider at MGH, my hospital, using medications for addiction, like methadone and Suboxone, similar to using insulin for diabetes. You have a medical brain disease, you take a medication, it regulates and stabilizes your brain, and as long as you keep taking the medications, you do really well. The problem is, I should also say for alcohol addiction, we use Antabuse, which many of you have heard of. You take it and then you drink alcohol and you barf. It discourages people from drinking. We use naltrexone and we use acamprosate, medications which help with the cravings for alcohol and help decrease how rewarding it is when you take a drink. So medical treatment for addictions is mainstream medicine, and it's very effective. The problem is it butts head to head with the abstinence-only ideology, the rigid ideology of these 12-step programs. Ironically, Alcoholics Anonymous was formed by someone named Bill Wilson. And he, in his recovery, used LSD to have the spiritual awakening that enabled him to become abstinent from alcohol, which is really good. And it fits right into what I'm going to talk about, Cali Sober, using cannabis and or other psychedelics to achieve sobriety from addiction. But then Bill W. went on to form Alcoholics Anonymous, which is so rigidly exclusive that it really excludes all of these other medications that he himself used to get into recovery. But anyways, Alcoholics Anonymous says, one drug is too many and 1,000 are never enough. You can't use any of these medications or other drugs to get into recovery. It has to be abstinence only. So I've been to Narcotics Anonymous meetings where people say, oh, you're not really in recovery because you're on Suboxone, or, oh, you're not really in recovery because you're on methadone. And again, this is just stigma and shame and completely unscientific and completely counterproductive. People are absolutely in stable recovery if they're on methadone or if they're on Suboxone working with a doctor. So I completely disagree, and I wonder why we're still following in terms of many of us are still following in terms of our definition of what recovery is and how to treat recovery, something that was created and was written in 1939. Our science has evolved so much in the last, 85 years. And furthermore, I have a lot of other problems with Alcoholics Anonymous and Narcotics Anonymous. People chain smoke cigarettes there. You're allowed to drink coffee and you're allowed to use tobacco, which are the quote unquote good drugs, but you're not allowed to use, Suboxone or methadone, or as we'll talk about, cannabis and psychedelics, which are the bad drugs. It's very hypocritical. It's very religious. It's very cult-like. I have a lot of problems with the 12-step programs. But anyways, increasingly over the last several decades, people have been using cannabis and psychedelics to help transition themselves out of addiction. Now, cannabis has always been saddled during the war on drugs with the label of a gateway drug, a gateway into addiction. We were taught in the DARE program about how if you experimented with cannabis in your teens, within years you'd be on the streets strung out on heroin. The gateway theory turned out to be not true at all. It was just another myth about cannabis to try to create a moral panic about it so that the drug war can criminalize cannabis and criminalize drug users. In reality, people are finding cannabis to be a gateway out of addiction for several reasons. For example, for opiate addiction, it helps with the withdrawal symptoms. When you're withdrawing from opiates, as unfortunately I've done many times, you have muscle aches and shakes and depression and anxiety and sweats and stomach cramping, and cannabis helps with all of these. It helps much better than the traditional pharmaceuticals that we use for these symptoms. Second of all, cannabis helps with many of the issues, so does psychedelics, by the way, which we'll discuss. Cannabis helps with many of the issues that help fuel the addiction in the first place. The untreated anxiety, the untreated depression, the malaise, the boredom, the poor distress tolerance, and it helps you work through some of your childhood traumatic experiences, which are a very big component. Adverse childhood experiences, ACE, are a very big component of people's addiction. Now enter the psychedelics. They've been tainted for decades as part of the war on drugs. When psychedelics, we're talking about the traditional psychedelics like psilocybin, LSD, and DMT, and some of the atypical psychedelics like MDMA, ecstasy, ketamine, which is the rage these days, and ayahuasca, which is ibogaine, which is an interesting medication that comes from the bark of a, West African shrub that is purportedly a very miraculous cure for opiate addiction. All of this needs further study, but the initial research is very promising that these psychedelics can be drastically helpful for opiate addiction, for alcohol addiction, and for addiction to other drugs. It's really pretty mind-blowing. Psychedelics, this is sort of a topic for the other day, work in many different ways. They change the blood flow to your brain and let parts of your brain communicate with each other that don't ordinarily communicate with each other. Therefore, they help us form newer pathways in the brain, not the same old negative thoughts and ruminations, but newer, more positive ways of thinking about the world. They have a quality called neuroplasticity. They help us create new brain formulations. They also make us very amenable to therapy in the weeks after a psychedelic experience. It's called psychedelic assisted therapy. So if you take MDMA, you don't just take the drug, you get MDMA assisted therapy where they prepare you for the sessions, they watch you carefully during the sessions for safety, and they help you integrate your sessions afterwards. You don't just take ketamine, you take ketamine associated therapy. You don't just take shrooms, magic mushrooms, or psilocybin. It's psilocybin associated therapy. And there's increasingly and pretty drastic evidence that in addition to helping people with treatment-resistant depression or trauma, that it actually is helping people out of addiction. So people who advocate for Cali Sober or California Sober are advocating not just that you could use Suboxone, methadone, antabuse, acamprosate, or naltrexone, the medical treatments to help get out of addiction, but that you could also use cannabis and psychedelics. Again, this is called California Sober because it was really pioneered in California. I'm not a big advocate of the name. I think we need a better name for it. But this has been really roundly criticized and resisted by, first of all, the 12-step community, the people in Alcoholics Anonymous and Narcotics Anonymous. Again, you're not really in recovery if you're using another mind-altering substance, which again is complete nonsense. In my very humble opinion, it completely ignores what we know about addiction. It's called harm reduction. I mean, of course, in a perfect world, we'd all meditate, eat tofu, do yoga, exercise, and we wouldn't need any drugs or alcohol. But in reality, most people need something at the end of the day. So it's obviously harm reduction if you're using cannabis, which nobody dies from, or using psychedelics, which are vastly safer than alcohol. Alcohol was responsible or involved in 178,000 deaths last year, in the year 2024. So harm reduction is using cannabis and psychedelics. It's also a question of meeting people where we are. The more we can have a broad recovery tent that includes people, the more we'll capture more people. We won't just alienate them like it's all, absolute sobriety, absolute abstinence, or nothing. You have to join AA or you don't have any other options. The more we can have an inclusive recovery tent, the more people we can involve and the more lives we can save. I should say the people who also are resisting, in addition to the AA 12-steppers that are resisting the idea of California Sober, are like the addiction psychiatrists. They are still believing that cannabis does have its harms, but it's not as dangerous as the addiction people think it is. And so they think that using cannabis for recovery is like heresy. And also, there's a big industrial complex. I call it the rehab industrial complex. The $40 billion rehab industry. They want people to be abstinent so they can do drug tests and follow the Alcoholics Anonymous ideology, which they've been doing for the last 100 years. And they're against Cali Sober as well. But again, I'm a big advocate, first of all, of being open-minded. Second of all, of including modern medical treatment into your recovery paradigm, which is why I'm such a big believer in Suboxone and methadone, for example, for opiate addiction. These medications work. They save lives. They've been associated with a 50 to 70% reduction in overdoses and deaths from opiate addiction. I mean, the problem is we have such a sporadic and fraying medical system. A lot of people can't get these life-saving treatments due to health insurance concerns and lack of providers, as much as due to stigma, shame, and ignorance. And then finally, I just think we need to, as I mentioned, reach more people, have an inclusive recovery tent, be open-minded about the new treatments that are coming down the line. And if we incorporate not only modern medicines, but concepts like California Sober, we're going to save a lot of lives. And not only that, we're going to save a lot of people from misery. There's a common misconception about addiction that people who are addicted are like these happy hedonists enjoying lives. But in reality, you've never met more miserable people than people who are addicted to drugs. And with these new concepts, such as California Sober, we can help save lives. Thank you so much for listening to my YouTube channel. This is Dr. Peter Grinspoon, signing out.